Welcome, everyone. My name is Melinda St. Louis, and I'm the Director of Public Citizens Medicare for All campaign. I'm really happy to welcome you to our Medicare for All Resolutions Coalition June discussion. Our movement for health justice has continued to really make tremendous strides in recent weeks. From the East Coast to the Midwest to the West Coast. Within the span of just a couple of weeks, the City Council of Trenton, New Jersey, the County Board of Supervisors of Milwaukee County, Wisconsin, and the City Council of Long Beach, California, going across the country, all passed resolutions in support of Medicare for All. And we know of a number of local efforts that are really getting closer to the finish line in small towns, big cities from coast to coast. And just last week, we got the great news that Representative Zoe Lofgren of California became the 117th co-sponsor of the Medicare for All Act of 2021, thanks to the tremendous organizing by activists in her district. So we're seeing, again, more and more members of Congress and municipalities coming on board and taking a stand in support of guaranteed health care. We're really thrilled that tonight we are going to have the chance to hear from Representative Tony Cardenas from California, who sits on the Energy and Commerce Committee in the House of Representatives, to share a view from Congress on the momentum for Medicare for All and for healthcare justice. And then we'll have the opportunity to hear from Shailly Gupta Barnes from the National Poor People's Campaign, who will discuss how our movement for health justice fits into a powerful multiracial, multi-issue movement to uplift 140 million people out of poverty in our country. And then we'll hear their perspective from our labor union allies, from Rhiannon Duryea from the Labor Campaign for Single Payer, and Raymond Jackson from the Amalgamated Transit Union Local 689. And then we'll have the opportunity to be inspired by the recent success story in Milwaukee County with our Wisconsin Revolution, our great partner, Andre Walton, and County Supervisor Ryan Clancy. So if you've joined our previous webinars, you'll notice that we're trying a different format this evening. We're using what's called a large meeting format. So you can share your video, but you won't be able to unmute yourself during the first part of our meeting when the panelists are speaking, given our large group. You can still use the chat feature to share who you are and where you're from. We hope you'll do that. And to ask questions and comments, and the panelists will try to answer those in the chat as well. And then we will have a second part of the meeting where we will randomly assign folks into small breakout rooms so that you can have a small group conversation. So then you'll be able to unmute yourself and talk with the folks in your group. So we're really excited to try this format tonight. So we'll explain more about that plan when we get to that part of the agenda. So without further ado, I'm really thrilled to welcome Representative Antonio Cardenas, who's represented California's 29th district since 2013. He previously served in the California State Assembly as well as the Los Angeles City Council, which, as we know, passed a Medicare for All resolution actually in November of 2019 after the incredible organizing by activists in our movement. Some might be here today. Representative Cardenas does serve on the Energy and Commerce Committee, and he signed on as the original co-sponsor of the Medicare for All Act of 2021 when it was introduced in March. So Representative Cardenas, thank you so much for joining us and sharing your perspective.
Well, thank you. I don't know if you're okay with me calling you Melinda or Miss St. Louis. You're much younger than me, so I was thinking about calling you Melinda, so if you're okay with that. Thank you, Melinda, for your leadership and for being a voice for people beyond your community and being a voice and an example for people not only in this country, but around the world. And to all the activists on this call as well, thank you for inviting me to share a few minutes with you about what's going on or not going on in Congress when it comes to Medicare for All. As Melinda mentioned, I'm on the Energy and Commerce Committee, which is the committee of jurisdiction that should, and I just got confirmation that the Chairman Pallone is committed to making sure that we have a hearing on Medicare for All in this Congress. In addition to that, we have the Chairwoman Chairwoman Velasquez from New York, and she chairs the Small Business Committee and she's committed to having a hearing on the Medicare for All bill as well. I want to give a special shout out to my colleague, Congresswoman Jayapal, who's been working with many of us over the years and who's been tireless in making sure that every little question that one of us may have or all the information that we may need is at our disposal. And because of that, we have a record number of members of Congress signing on to her Medicare for All bill. I mean, she doesn't call it hers, but I want to give her the due respect is that she was the original author of the bill, and many of us were proud to be co-authors as well. I do want to also mention that I love the fact that so many people at every age and across the spectrum in America is working hard to make sure that the awareness for Medicare for All and that we is there, and that more and more people on the streets of America understand how critical it is, but also that every elected official in America understands how important it is for all of us not only to get behind it, but to actually make sure it comes to fruition. The reason why I say that is because as of this moment, it's my understanding that not one Republican has signed on to the bill. I may be wrong, but I doubt it. As of my staff checking, double checking, triple checking, as of this morning, not one Republican has signed on to the bill. The reason why I mention that is because I hope that you are able to use the energy that you have to focus on encouraging Democrats to sign on to the bill, and in any way that you can, by some miracle, getting Republicans to sign on to the bill as well. Because the only way we're going to get this bill through both houses, is if we get some kind of support or some kind of effort where we start getting Republicans to see the light and to actually support Medicare for All in the United States Senate. I mentioned that to you because what I was asked to do today is to give you a latest report as of today as to where the bill is at in the United States Congress. All of you are very much aware about how important this is to every person in America. And one of the things that I'd like to share with you is that what I love about our democracy is that in this country, the son of immigrants, the youngest of 11 children, whose parents only went to the first and second grade, whose children had to go to a federally qualified health center once they were created just over 50 years ago. Now, families in America were able to get some access to preventable health care. Without that, the only place for me and my brothers and sisters, I'm that person, that youngest of 11, son of immigrants who's now a congressman. I had lived in a household where what we did in our home, we prayed for each other, we took an aspirin, and only and until we thought that somebody was in dire need did we go to the emergency room. But ladies and gentlemen, that is still happening today to millions and millions of people in America. And I think it's really important that the success of Medicare for All actually come to pass, because that needs to end. It needs to end everywhere in the world, but here in America, the most capable, the most affluent country on the planet, the country that has the most power on the planet, we need to prove to the rest of the world that we can get it right, that we can make sure that no one suffers through not having access to healthcare, that no one actually suffers that anxiety and that angst of looking at their child and saying, I can wait before I take them to the emergency room. Maybe they're going to be okay. Far too often, the answer is no, they're not. And one of the things that's incredibly important, especially for people of color in America, that the numbers don't lie. One of the reasons why so many people of color in America, so many hardworking families end up having late stage cancer and things of that nature diagnosed very late in life is because they put off preventable care. And what the Affordable Care Act, what it will do, it will make accessible preventative care, which means that we're finally going to see the disparities of single moms, of women, of people of color in America, finally see the numbers where they should be, where everybody gets real access to healthcare, and when every person actually is going to be able to have preventative care, so that they don't end up having the situation so dire that they lose their life because they didn't get diagnosed early on enough. Not in America. Shouldn't happen anywhere in the world, but that is still happening in America to millions and millions of children, men and women across the country. So I was asked to make some open remarks to your event. I pray that you continue with your success and the energy and the love and the commitment that you're making and keeping out there. And also, I want to also say that I've had the privilege and the honor of working with the most amazing person in the world, John Lewis, who I was a colleague with for 6 years in Congress before we lost him. So he always reminded every member, Republican and Democrat, that there is such good thing as good trouble. So I want to thank all of you for making and participating in good trouble to help save lives by passing the Affordable Care Act. So thank you so much for having me and inviting me. So Melinda, back to you.
Thank you. There was a question about the Affordable Care Act. I think you may have misspoke. I think you meant to say Medicare for all, right?
I'm sorry, Medicare for all. I'm sorry.
Okay.
Yeah, I'm sorry, Medicare for all.
I knew that was the case. Thank you so much for joining us and taking time out of your busy schedule. I know that there's so much going on and fights on many fronts, and we are really grateful that you signed on this year to the bill, and thank you for your leadership. We look forward to supporting efforts in the Energy and Commerce Committee to get a hearing and to move this bill forward. So thank you very much.
Yes, as I reported, it's very important for the chairperson, in this case, it's Frank Pallone, to actually make that commitment, and he's made that commitment. And so the ball is rolling in the right direction, and that's a huge victory for everybody. So thank you all very much. Thank
you, Representative Cardenas. We very much appreciate it. And thanks to everyone who has been mobilizing in California to make this happen. So thank you. Next, I'm really honored to welcome Shailly Gupta-Barnes, who's the policy director for the Kairos Center and the National Poor People's Campaign. The Poor People's Campaign has been an incredibly important partner in our struggle for health justice, and has been a leader in centering the voices of low-wage and low-wealth Americans and making the moral case for what they're calling a third Reconstruction. Shailly, can you tell us about the health justice plank of the third Reconstruction and opportunities for Medicare for All advocates to support your multiracial and multi-issue progressive agenda?
Yes, of course. And, thank you to Melinda and Public Citizen, everyone who's been organizing around healthcare in this really defining moment that we're in as a country, a moment where real change is possible out of the crises that we've been facing for decades. So recently, the Poor People's Campaign worked with Representatives Lee, Representatives Jayapal, and many others to introduce this third Reconstruction resolution. And the name is actually a reference to the unfulfilled history of the first Reconstruction after the Civil War, as well as the second Reconstruction, which we more often refer to as the Civil Rights Movement. But really, after the first Reconstruction, we saw these Black-white fusion coalitions, political coalitions, emerge across the South among freed slaves and Southern whites, where they were electing multiracial and in some places in the South, predominantly Black representatives into office. They established new constitutions, guaranteed economic rights, the rights to education, labor, and political rights, the right to vote. And through that time, there was also federal money going to freedmen's bureaus that provided for food, housing, and healthcare as one of its 4 planks, alongside education, to former slaves and poor whites in the South. This was dismantled and deconstructed, you could say, as those coalitions became powerful enough to actually start implementing and building broad support for programs that would require an infusion of resources, that would require taxes on the wealthy to really carry out. And so that was dismantled. And then the second Reconstruction, again, this advance of political rights, moving towards economic rights, demands for jobs, income, healthcare, again, central in the civil rights movement, was dismantled, deconstructed by the assassination of its leaders, by organized and embedded violence against the movement that was building around political and economic equity. And we could say that in the 50 years since the dismantling of that second Reconstruction, things have gotten worse, including around the persistent denial of adequate, affordable, quality healthcare. even amidst this, the worst public health crisis that many of us have ever seen. And so all of this means that healthcare is really at the forefront of our agenda and a key component of the third Reconstruction resolution. Among the third Reconstruction has many different elements to it, but among our healthcare components is the expansion of Medicaid. Remember, our campaign is centered around the needs and demands of the 140 million poor and low-income people in the country, the 87 million people who are uninsured and underinsured before the pandemic. And the expansion of Medicaid will reach critical numbers of poor people, in a way that no other program does yet. And so protecting Medicare comes alongside the expansion of Medicaid and pushing for a universal single payer health care system for everybody. But we also call for the expansion of our public health infrastructure, including in rural hospitals, Indian health services, and more. Really to provide for all the social determinants of health, right? Because poor and low-income people aren't just facing one deprivation, but multiple and at all times. So whether this is in the form of living wages, guaranteed incomes, adequate housing, clean water and air, and access to food and quality, diverse public education, this is what the third Reconstruction demands to fulfill, what was left unfinished during the first two. And all of this must necessarily be funded through fair taxation and redirecting military spending and other spending that is unnecessary, that causes more harm and violence in our lives and communities, and moving resources and raising resources to spend on the things we need. So we know it is historic to have a resolution that takes up these issues so clearly and keeping them all side by side, keeping the issues of healthcare alongside the issue of jobs and income, alongside the issue of fair taxation and all of these other things. And we also know that we won't see any of this realized until, as we've seen it with everything else, we summon the political will to do so. And so the Poor People's Campaign, we're organized across more than 40 states in the country. We have a network of partners, including Public Citizen and possibly several others on the call, faith leaders, labor unions. And we're really encouraging everybody to take up this resolution as something that also reflects all of our priorities. So we push this thing forward together, holding all of these components together. Last week, we coordinated actions across 30 states, in front of the offices of 50 different members of Congress to raise the attention of why this moment calls for a third Reconstruction. This week, we're in West Virginia, standing with West Virginians, Black, white, brown West Virginians, hundreds of people, who are standing up and saying that Senator Manchin is not responding to or representing their needs. And next week, we're holding a National Poor People's Assembly on June 21st, where we are going to launch a one-year organizing drive towards June 2022 that will, where we will begin over the course of the next year, but we will continue to build the power to summon that political will to realize this third Reconstruction. Will convene in Washington, D.C. next year, because that's what it's going to take. And I just wanted to finish by, one quote from somebody who, so a leader from the 1968 Poor People's Campaign, obviously Dr. Martin Luther King, was working alongside many other leaders of poor people's organizations, and at an event honoring W.E.B. Du Bois, the historian and scholar who wrote Black Reconstruction, which was a reflection of the first Reconstruction during another moment of crisis and opportunity. He wrote it during the 1930s or the early 20th century. And he said, at that memorial, Dr. King said, history teaches that it is not enough for people to be angry. The supreme task is to organize and unite people so their anger becomes a transforming force. So that is our task right now. That is how we will build the political will for Medicare for all. That is how we will build the political will for all of these other elements that we need to see, not just for the 140 million poor and low-income people in the country, but for every single person, because these are basic needs, and we all suffer when 40% of this country cannot reach its full potential. So that is our task of this coming year and moment. We invite everybody to join us for June 21st online, as well as, towards building to next year, towards June 2022, so we can move forward together, as we say, and not one step back.
Thank you so much, Shailly, and for those powerful words. And please do drop in the chat the information for people to know about the June 21st event. And we're really thrilled to partner with you all and to build our movement for health justice alongside all of the other really important movements that are connected together as part of the Poor People's Campaign. So thank you. Now, as I mentioned before, we're really thrilled to welcome some of our labor union sisters and brothers. First, I'd like to welcome Raymond Jackson. Mr. Jackson is the president of the Amalgamated Transit Union, ATU Local 689, which is, he's a 30-year employee of the Washington Metropolitan Area Transit Authority. That's my public transit system here in the District of Columbia and Maryland, Virginia. And his local recently sent a powerful letter in support of Medicare for All to advocate for a resolution that was adopted by the Prince George's County Board in Maryland, which was very exciting. So Mr. Jackson, thanks for joining us. And can you share your perspective on organizing for Medicare for All as a local labor leader? Thanks again for joining us.
Thank you for having me. And I'm gonna cheat a little bit and look down at my notes. First, I want to say to everyone, thanks for having me. I'm Raymond Jackson. I'm the president of the Amalgamated Transit Union, Local 689. We represent over 13,000 members in our nation's capital, from the WMATA workers to the Fairfax Connector, Circulator, Alexandria Dash, DC Streetcar, Walton County Transit, as well as the majority of the Metro Access workers in this region. I want to thank our panelists and public citizens, along with any of the other groups out there that's fighting for Medicare for all. There's a terrible rumor out there that unions oppose Medicare for all. And I'm gonna tell you what's funny about this rumor. The only time you seem to hear it is when some politician is telling you why they shouldn't support Medicare for all. They'll tell you that the unions doesn't want it, and I'm here to tell you that that is not true. The fact that unions oppose this, or that trade deals or tax giveaways, or even that unions support a bunch of good things, never seem to get brought up as frequently as these rumors. I'm here today to let you know that many labor unions, including the Amalgamated Transit Unions, Local 689, strongly support Medicare for all and are committed to fighting for a single-payer system that actually treats healthcare as a human right, and not another piece of, and not another place to nickel and dime. As a labor union, we spend a lot of our time fighting for health insurance and health improvements for our members. And one of the biggest things we come across is the companies out here who try to cut costs off the back of their workers. Our members at WMATA, we're one of the biggest systems in this country, enjoy what most people would consider a Cadillac plan. But we as members of 689 and the workers at WMATA know that on any given day, that plan can be taken away from us. And that's why we must continue to fight as we do. As far as the American health system goes, few in this country have it better than we do. Every year, as we watch our premiums rise, eating away at wages gained while we're sitting at the bargaining table, we watch the pressure mounts on WMATA to find ways to cut costs at the expense of its workers. Every year, they try and find a way to decrease our benefits. Every contract negotiated, WMATA tries to take advantage of rising healthcare costs to withhold money that could be going to our members' families. We used to have healthcare coverage for retirees to help them until they reach Medicare age, but even this was taken away by an arbitrator in 2010. And what that means is our employees who were hired after January 1, 2010 will not have health insurance when they retire. And can you imagine operating a bus for 27 to 30 years of your life and then not having health insurance when you retire? Some of the private transit companies that we deal with offer plans with $6,000 deductibles. And if you know, like I know, with a $6,000 deductible and you're barely making above minimum wage, you really don't have health insurance. The whole point of the system is to make the workers dependent on their employer. We know all too well that employers will use health coverage as a tool to prevent their workers from standing up for themselves. Back in 2019, we had an 85-day strike at one of our facilities out in Northern Virginia, our Cinderbed Road facility. As soon as these workers who stood up for themselves and went on strike, trying to improve their standard of living in one of the richest areas in this country, Fairfax County, the employer immediately cut off their healthcare benefits. A few days before the strike, we had one of our members had just given birth, brand new baby. We had workers out there rationing out their insulin injections. These are things that their families could have benefited from. We had families out there prolonging surgeries and doctor's appointments. Again, because the private sector contractors cut their health insurance off. Medicare for all will be one of the largest victories for workers' rights in this country if we can get this bill passed. Once workers and unions no longer have to constantly be on the defense, fighting to keep basic healthcare plans, we can finally move toward and up to the offense, raising wages, fighting the real retirement fights, and respect on the job. So I ask you this, what do we need to do? We need to keep fighting and organizing. I encourage you to reach out to the labor unions in your area. Try to meet with them. I think many unions would be shocked at the improved quality of care they would find for their members if the expanded Medicare for All bill were to pass. Dental and vision would finally be considered healthcare again, instead of separate things that need separate insurance plans. If you're in a union, organize to get your members active in this fight, in this labor campaign for single-payer health insurance. The fight for Medicare for All has gone on for a long time, but we know that the last few years have really pushed this idea into the spotlight. We can really take control of this issue. Our time to fight is right now. And with that being said, I want to thank everyone for giving me the opportunity to be here tonight. And remember, never give up the fight. ATU Local 689 will be right there with you for this fight for Medicare for All. We stand with you. Together we win. Together we fight. And I want to thank you all for having me.
Thank you so much, President Jackson. Those were incredibly powerful words, and I think everything that you said is so true and just crystallized so clearly. So thank you for your clarity of vision and for the leadership that you are showing and demonstrating. And now I'd like to continue our focus on organizing with labor unions. I'm excited to hear from the new director of the labor campaign for single payer, Rhiannon Duryea. Rhiannon, what additional advice do you have for local health justice activists to engage with local labor unions and their organizing for Medicare for All? Mr. Jackson had some really great ideas. Just wanted to throw it over to you as well.
Yeah, thank you so much, President Jackson. I'm not sure that I have much more that I can add. You very, very adeptly laid it out for everyone. I think the only thing that I can add is that when you're thinking about how to organize with labor unions, it's best to think about it like you're organizing a workplace and understanding that you're going to have your most strong supporters, your people on the fence, and then the people who you need to do a lot of work to get there and not oppose organizing your shop room floor. And it's really, really important to understand the self-interest of those individuals and what would motivate them to join a union that you're organizing in your workplace. And the same goes when you're working with local unions and organizing them to join the Medicare for All coalition. Self-interest gets a really bad rap. We want to think that, you know, we're selfless, we're giving ourselves, but if we're talking about organizing, identifying self-interest and using that as leverage to agitate around the issue you care about is how you're going to best motivate people. And it's one of the great things that President Jackson did in his letter to the County Board of Commissioners, is laid out the self-interest that ATU 689 has in supporting Medicare for All. You know, dream of the day where we no longer have to negotiate with employers over health insurance and can instead spend that time focusing on wage increases, improvements to working conditions, and retirement benefits. Plain and simple, that's pretty easy. And so a lot of unions are going to share those same concerns and share the same frustrations with healthcare continuing to take up a larger and larger share of what you're able to negotiate and the gains you're able to make at the bargaining table. And it's also worth understanding some of the concerns that local labor unions might have about Medicare for All, just as you want to be aware of the concerns that workers in a shop room floor would have about joining a union. And a lot of those are going to be centered around our dominant cultural narrative, like the big lies that we're told, whether about it's Medicare or unions in general. And how do we get past those and overcome those fears and objections in a way that helps people vision a brighter and better future that they can have through Medicare for All. And that's going to be about, you know, building relationships, understanding the issues that your local labor leaders and their members are facing so that you can best identify that self-interest, agitate around that, and move them to a position of support for Medicare for All. You know, and the good news is we did reach a high watermark in 2019 where the unions representing the majority of organized workers supported Medicare for All. And now it's just time for us to get activated. We need more folks like President Jackson taking action in support of Medicare for All. And it's going to take all of us engaging with our community, with our local unions in order to make that happen. And at the end of the day, the most important thing you can do is organize your workplace if you're in an unorganized workplace, and get involved with your union if you are in an organized workplace. And I see some comments in the chat about unions that are self-insured. We could spend a lot of time talking about Taft-Hartley funds and some of the objections that those create. Maybe that could be a separate webinar, is how to overcome some of those common objections. But thank you guys for your time. Thank you for your commitment to Medicare for All. And we are with you in this fight.
Thank you so much, Rhiannon. And maybe if you want to answer a few of those things in the chat, that would be great. And I agree, we could have a whole other webinar on those topics. And I want to thank both of you for sharing. I think that a lot of people find it very productive to learn more and how they can engage with local labor unions. So thank you so much. Now, before we turn it over to our breakout sessions, I'm really excited to invite Andre Walton, who is with Our Wisconsin Revolution, who helped to achieve a recent victory in winning a Medicare for All resolution in Milwaukee County. And so I'll turn it over to you, Andre.
Thank you, Melinda. Like you said, my name is Andre Walton. I am the Southeast Regional Organizer for Our Wisconsin Revolution. And just to let you guys know a little bit of background about Milwaukee is that it's one of two cities that is known for the worst places to be as a Black person. The first city is also in Wisconsin, and that city is Racine, Wisconsin. So Milwaukee is number 2, so you can understand the disparities that go on in that city. But I was happy to work with Supervisor Clancy on passing this resolution. And to his credit, he's been on the front lines of all racial and social and economic justice fights. But the reason why it's so important is that those disparities in Milwaukee are astounding. I think I think for the median income, Black people make half of what white people make in Milwaukee. So when it comes to healthcare, we heavily depend on our state-funded insurance, which is Badger Care. And if you make too much, then you cannot get on Badger Care, and you're probably forced to either have employer-sponsored healthcare or you need the ACA, which the ACA isn't actually as affordable as some would say. Um, so I think to have Badger Care, you have to make less than, I believe, $27,000 a year, which is extremely low. So we fought to get the Medicare for All resolution on the county board, and we worked with Milwaukee DSA and Citizen Action of Milwaukee, and we put together this resolution to pass on the county board. And with the help of Public Citizen, they helped us with resources to learn how to speak to some of the county supervisors and work on the resolution with us. So we were really happy to get this passed. And it was a lot due to the organizer and the organizers' help and the efforts of a lot of the volunteers that we have in working on this resolution. So I was really happy to see it pass. It passed pretty easily as well. I think the vote was 15-2, so it really shows that we're making real waves on Medicare for all. So it's really becoming more mainstream, and we need to get that into the public sphere. And I think the reason why that many of our federal legislators don't support it doesn't have to do with any moral concern, and more has to do with the problem of campaign finance. They usually take donations from the health insurance industry, or they have influence from the lobbyists that work for the health insurance industry, and they fund their campaigns. So I think in order to get a true Medicare for all legislation passed in the House and the Senate, we need campaign finance reform. But we don't really seem to have that problem on the state. Well, obviously there is a state level because we have gerrymandering in Wisconsin, but at least on the city level, our representatives actually represent the people that they were elected to represent. But yeah, that's what I have to say about that. I'm happy to introduce County Board Supervisor Ryan Clancy of the 4th District in Milwaukee County. He's been a huge help on this resolution. I believe he was the first county board member that I spoke to, and he supported the resolution. Like I said, he's pretty much a trailblazer on the county board. I've never seen this guy scared to say his opinion. He's always out there protesting and fighting for the people. So I was happy to have him as an ally on this resolution. So I'll let you take it from here, Ryan.
Fantastic. Thanks so much, Andre. And I do want to thank too Melissa St. Louis and Public Citizen for having me today, as well as Citizen Action and the Milwaukee DSA. But really, the biggest thank you should go to you, Andre, and our Wisconsin Revolution. You were responsible for this campaign and this resolution. It would not have passed without you. So thank you for that. I am a county supervisor here in Milwaukee, but I'm also a small business owner and a father. And I used those experiences to sort of inform my advocacy of a Medicare for All resolution. And it did pass in Milwaukee County in May of this year. As a small business owner, I knew that having health insurance was important. I had usually had it through an employer. And my wife and I, when we opened up our small business 7 years ago now, became one of the very few folks in the service industry who offered health insurance to our employees. And when we first set our, talked to the insurance companies and set everything up, we offered to pay 80% of the premium. But that wasn't enough for many of our employees who had to choose between food and rent and childcare and medications. It looked like health insurance was a luxury, and it really should not be treated that way. As a result, many of our employees still chose to go without health insurance. We also had many employees who were, at or near or just under that 30-hour-a-week minimum that the insurance company mandated employees work for no good reason before we could agree to pay that 80% of the premium. So there were many, weeks and months in which we padded employees' hours. Frankly, sometimes we had to lie to our own insurance company in order to make sure that our employees were taken care of. The system is clearly broken. And many employers don't jump through those hoops, and it's not, it's just inherently unfair to have health insurance tied to employment and employers like that. In March of 2020, we closed our doors due to the pandemic. It was the right thing to do, and we used the rest of the money in our business account to pay our employees severance packages. And we had assumed that we would be down for a couple of weeks. As it turned out, it was much, much more than that. And we ran out of money. So that meant that both our former employees went without insurance, but that for the first time in a long time, my wife and I and our 6-year-old child didn't have insurance either. And I think that really underscored for me how incredibly important it was. I was trying my best as an elected representative to be in the community to help folks through their own losses from COVID, but I was absolutely terrified that I would bring the pandemic back into our house and into my child's life, inadvertently. And because we didn't have insurance, I knew that even if, we didn't suffer massive and long-term physical effects from COVID, that if one of us got COVID and had to go to the hospital to be treated, if we didn't have insurance, that it would ruin us financially. And it was terrifying. I mean, as a father and as a community member, nobody should have to go through that. In January, we finally scraped together enough to buy insurance on the private marketplace, and I was, as an employer, just stunned with how much that cost and how little it actually covered. We've been putting off medical appointments for months and are just finally getting caught up with those. But many other families have it far, far worse. The course of what we have now is good enough from the other side is absolutely wrong. The current system is failing many families, many individuals all across the US. And it's also failing businesses like ours because it puts us at a competitive disadvantage. When we reopen again, and I hope we will get some federal money to do so, we're unionizing, so we will come back as a union shop in the service industry, and we will absolutely provide health insurance, but we'll be competing with folks up the block and across the city who don't have those same priorities. So even from a business owner's perspective, it does not make sense to tie insurance to employment. It's not responsible, it's not compassionate, it's not equitable, and it makes our whole community less safe. So as a small business owner, as a father, and as an elected, it's clear to me that passing Medicaid for all now is the right thing to do. And thank you again, Andre Walton, for your advocacy.
And I really want to thank Representative Cardenas, obviously, and Supervisor Clancy for taking time out of your busy schedules to join us, to Ms. Gupta Barnes and Mr. Jackson for sharing your perspectives, and everyone else as well, and everyone who shared their own stories and organizing with one another in the breakout groups. I do want to just make one more plea that no matter where you are in your organizing journey, we want you to know that we're here to support you. So please, you use the toolkit. I pasted it in the chat before. Brittany, if you want to paste it in again, the resources that we have on our website at medicareforallresolutions.org. Make sure your town is on our map. Be in touch with us. Let us know what you're up to. We want to work and support you. And I just, in closing, I just want to note again that all this work is happening in the context of both our collective mourning as our country just passed the tragic milestone of 600,000 lives lost to COVID, and our collective hope that as vaccinations continue and cases drop, we're starting to emerge, hopefully, from the worst of this pandemic. So, and what's very clear is that we know we must continue to push our elected officials at all levels of government to not simply go back to normal, when normal means prioritizing corporate profits over people's lives and livelihoods. We know our work for guaranteed healthcare is more urgent than ever. And so for that reason, it's so important, and I'm always so inspired to gather together with all of you, to inspire one another, to take action. I think Mr. Jackson, President Jackson really said it so well, saying we need to all be in this fight now. And I'm so glad to be doing it with all of you. And thanks for those who put some in the chat of your the reports from your groups. You can hit save chat if you would like to save that for yourself. And we will look forward to continuing this work with all of you. So thank you so much for joining, and have a wonderful evening.